we need better tools to work remotely than we've been given to date.
Yes. And with the idea remote may be the new reality moving
the new
forward.
normal. Yeah. Dr. Barich, Matt, Northwell Health, you may have this massive system with people everywhere. Any thoughts?
Yeah, so it's been an interesting ride. So I started here at Northwell 2.5 years ago. So within 2 months of my start here, the pandemic hit, and my job morphed tremendously from sort of looking at the IT infrastructure and trying to move things into a more modern approach to essentially the task that was described, which is, what does a completely remote radiologist department look like, and where else can we live or work remotely in that paradigm? And so we saw the same shortages: techs, nurses. I think the thing we didn't mention, or you touched on a bit, is IT personnel and support staff, which I think is unbelievably important now in this new world, and techs, residents as well. We went very quickly to basically as many of our radiologists being remote as possible in a time period of about 3 weeks. And so we had to build the tools and the systems to allow that to occur, including, residency training. We're having this conversation, right? We're all remote. We're all but based on the backgrounds, which are a bit blurry, I bet most of us are sitting at home. I myself am sitting at home, and I'm actually on the clinical service today. And I'm going to be reading from home and training residents from home. The tools that we've implemented, or that we need in order to be able to do that, should simulate the process of being together, reviewing a case with a resident in tandem. And we've been somewhat successful. It's been interesting to watch residents. Some view this as very positive, that rather than them sitting behind me looking over my shoulder, they see everything that I see on their screen. We do full screen sharing of our workstations, and we share and trade back mouse control, which is really very important. So we can essentially share what each other is looking at and do that review.
And Matt, when you're sharing, are you also seeing their faces and their expressions, or is it you're either looking at the image or you're looking at them, but not both? Because when I'm teaching somebody in person, whether they're not, I can, sort of figure out whether or not they're actually understanding what I'm saying. And there's a lot in body language.
Yes.
Regarding, and it's not just teaching, but it's also communication with colleagues, communication, with referring clinicians, et cetera. And so one of the tools that I would like would be something that allows me to both see the PACS and high-res images and be able to see the person that I'm communicating with, even if it means another monitor or another setup.
So it's interesting. So we have a full 4-monitor system. That's our default monitor system.
Okay.
We although our PACS system has a native share capability, but it does exactly what you say. You then can't see the person. And also you can't hear the person. Now you're on a phone, and I'm holding the phone, or I have it on speakerphone. It's not quite great. So we very quickly morphed to a Microsoft Teams approach, where we are sharing. We put cameras on almost all the workstations so that you can see the face of the resident or the person you're speaking with. I find that unbelievably helpful, because exactly what you said. You can see the puzzled look on someone's face very quickly when they don't quite understand what you're talking about, and you can, but it really is hard to do that. And now you're not native to your PACS system. You're now screen sharing over Teams, where you're either looking at somebody else's workstation, and you're sharing screen control, and you have all the problems of lag and the like, which is not perfect. Or you're flipping back, screen sharing back and forth, which is also very problematic as well. So, what I find is, the actual methodology is I'd rather they share their screen with me so that I can see what they saw. And I've already hopefully looked at the case in that regard.
Right. The fact that you've looked at the case is important because I know over Teams, there's some pretty high compression. And so the quality of the images, you know, really depends on a lot of factors, as you said, log and bandwidth. But Teams is never going to be as good, in my experience, as looking at the original image.